Hello and welcome to You Matter. Hi and welcome to episode 38 of You Matter and the next in my series of Clinician and. In this episode, I'm talking to physiotherapist Charli Robertson, who is, wait for it, clinician and celebrant, wine expert, woman who identifies as gay with a diagnosis of autism and ADHD, someone in the middle of a PhD. Oh, there's one more. What is it? I can't remember. I'll have to let Charli tell you, but it's a long list of ands. And I think you'll enjoy this. Well, hopefully you've been enjoying this whole series that I think is doing a really great job of shining a light on the things that go on for physiotherapists, and let's face it, everybody, but in this context, physiotherapists and clinicians, as well as the things they do in clinic. So sit back, enjoy this episode with Charli, and I'll be back at the end. So hi, and welcome to this next episode of You Matter, and also the next in my series of Clinician and episodes. I'm so pleased I did this. I think I hadn't really contemplated how many clinician and things there were. And what it's doing is giving a really nice insight into all the things that go on for clinicians outside being a clinician. Sometimes they directly relate to their work as a clinician, sometimes completely different things. And today's guest, Charli Robertson, sorry, name wrong already, Charli Robertson. I think so far, Charli wins the prize for the longest list of ands on the end of clinician. I'm going to get her to recite them for you, so I don't miss any. But the clinical, the boring side of it is Charli is a self-employed physiotherapist. She consults for England GB Hockey, FA Wales, the LTA, occasionally British horse racing, and in her free time she does a PhD. And believe it or not, that's before the ands. So hi Charli, welcome to You Matter.
Hi, thanks for having me on.
Pleasure. Now over to you. What are your ands? Clinician and
I think the sort of immediate ones are I am a gay woman. I fall into the LGBTQ plus category. I am autistic. I have ADHD, predominantly inattentive. I have a long-term foot injury, which gives me sort of a less visible disability in working in the sports environment that I do. That adds to that. But I suppose the sort of main topic that you got me on for today was around being a family celebrant and education in wine and things like that.
yeah. I mean, it was the celebrant that I'd seen on LinkedIn, and I was hooked on the celebrant. I didn't realize that the rest of it was there as well. Yeah, I just thought, gosh, that's interesting. I've got a couple of friends actually who are celebrants, but I certainly didn't know any other physiotherapists who are celebrants. And actually, when we talked a bit last week, I realized I didn't even really understand what a celebrant was. So just in case that is the case for anyone else listening, can we start with the celebrant bit?
Yeah, so you can have different kinds of celebrants. So you probably, if you're sort of into more religious ceremony type stuff, the equivalent of a less gaudy, like wedding, christenings, funerals, things like that. I am a family celebrant. I'm also an independent celebrant, so I'm not with humanists. I'm not with any particular, group other than the UK Society of Celebrants. And yeah, so I can or have been trained in leading wedding ceremonies and naming ceremonies, be that a baby or a combined family or a individual transitioning to their true gender and things like that. So I elected not to do the funeral celebrant side of things. Yeah, that was my first step.
Well, that was my misunderstanding, because I think one of my friends who is a celebrant only does funerals, and I thought that's what a celebrant was. And when we spoke a few weeks ago, you said, no, I'm into the joy side of it, so leave the funerals.
I mean, I think you always have to bring a bit of joy to a funeral. You are celebrating, someone that you thought was fantastic enough to have a funeral for.
Yeah.
But yeah, I chose to do family because it's a little bit more obvious where the joy comes from there.
Yeah. Most of those occasions are hopefully going to be because a joyful situation is happening, aren't they?
Absolutely.
So Charlie, how does a physiotherapist get to be a celebrant? How does that happen?
It's a relatively recent thing. So over the years, I've had various friends, hey, I'd love you to do my wedding. I think you'd be really good at it. Standing at the front and running the show. And then obviously we had lockdown in 2020. I also happened to have my autism diagnosis at the start of 2020, and I was, as a result, seeing a psychologist who's got a specialism in neurodivergence. And part of that sort of work that I did with her was around diluting the focus. So if there's an issue at work or an issue in a particular area of your life, having other strings to your bow allows particularly those who are neurodivergent and can tend towards hyper focusing on those issues, that it's good to have that breadth in your activities in your life, and actually the things that seem really massive, if you hyper focus on them, maybe don't feel quite so big. And so partly you're locked away and you've got nothing else to do. Partly it's diluting the focus and giving myself a different sort of brain activity away from work and study. And partly because I quite like bringing the joy. I get to wear my fancy shoes and get dressed up and stuff. It's quite nice.
Yeah, so partly as you say, something to occupy a busy neurodivergent mind, partly as a way to spread joy or to be associated with other people's joy. And does the wine, does that fit into that same thing of something else to occupy your mind?
Yeah, I mean, part of me as a person, I suppose, rather than specifically being neurodivergent, is that I just love learning stuff. And when I was working with British Skeleton, one of our coaches was a trainee master of wine, and so he would be doing various tastings and notes and everything else, and we'd sort of chat about it, and he would teach me various little bits and pieces. And so, a couple of years ago, I started doing a WSET level 2 wine certificate. Passed that. I passed the tasting and notes element of the level 3, but then had COVID for 2 weeks before the theory exam, so I didn't have any time to revise, and then was doing a full-time PhD, so I haven't really been able to go back and finish that one off. But yeah, I got the level 2 certificate. Just love learning stuff, and yeah, it kind of ties in nicely if people want to chat over wine or anything like that in terms of celebrations or events, gatherings.
I guess the two things do have a crossover, don't they?
Yes.
Just as you were talking, Charlie, I remember something you said last time we spoke, and I want to pick up this phrase because it was so lovely. You talked about your mind being like, did you say your nana's attic or somebody's nana's attic?
Yes. Yeah. So I think that's, I don't know if other people would describe their brains like this as autistic people, but it's one of the doctors that I work with at the minute also described it as dream country from the BFG, if anyone's ever seen the animated film of that. Just full of all this information, but you can't always access it. So the analogy of your nan's attic is that it's all covered in dust sheets and got no idea where anything is, and you just happen to be in conversation with her one day, and suddenly she's like, oh, wait a minute, and she nips upstairs and she goes and gets this priceless artifact or Olympic gold medal, and because it's come out in context, she knows exactly where it is, and it comes out straight away, and it can be applied really well there. But in terms of being told interview style or role play style, tell us about this, that's very, very difficult. So yeah, the learning is like there's plenty of stuff in there. It's just when it comes out, and some people who don't know me that well think that I may only have knowledge on a certain area, or don't offer up loads of information just off the bat. But then they're like, oh, actually, you know quite a lot, don't you? And yeah, I think that's probably the case for quite a lot of neurodivergent people, certainly.
So, am I understanding it right that for this sort of for the contents of this amazing attic, or for a particular, let's stay with the analogy, for a particular object to be brought out from this attic, the right conversational trigger, the right question needs
Yes.
to be delivered. So how does it feel knowing that that is the case, that so I almost get this sense that you have to wait for a stimulus?
Yeah. So it's funny that you said about the right conversational trigger or the right question. It's how I have said when I've worked with psychologists before, I've always said, I need you to ask the right question. I can offer you up anything. I can give you the information that you ask for. But if you just say, tell me how you're feeling or tell me about this, it's not necessarily that anything will come out, or if stuff does come out, it might just be complete drivel, verbal diarrhea, completely unrelated, off on a tangent, who knows what it is. And it's frustrating in the sense that it makes, or I feel that it makes people perceive me as less capable than I am.
Yeah.
And so in situations, interviews is probably the best one. Tell us about this, or you've got an injury, a hamstring's come in. What would you do? What would you want to know? How would you do this? Blah, 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 blah. And I'm sat there thinking, but there's so much context to that I don't have. There's a relationship with an individual that I have no idea about right now. There's a visible and tangible, touchable presentation that I cannot see. And so getting that information out is quite hard. And yet when I'm in a medical room with a player, talking about an injury, bringing it all the little bits and pieces will come out of all the different jars in Dream Country or from all the different dust sheets in your nan's attic. And it's really useful. But yeah, in terms of being asked to, inverted commas, perform as such, is very, very difficult. Yeah.
So when a patient's with you, although the patient isn't there constructing questions, it's almost like the patient's presence with their whole presentation for you is, it's okay, I understand what's being asked of me, I can...
Yes, it's real.
Yeah.
I can see it, I can feel it, they're giving me their history. I can ask sort of more detail on this and this and this and all those little minutiae that give you that. I think as much as I'm very detail focused, I would say that I'm probably quite a feeling therapist in terms of it is very feeling in terms of how I deliver things. It's always backed by your evidence and everything else. Like I'm very science driven, but in terms of it has to be real. So as a sports therapist, you have to do pitch side training courses, and all of that is with a dummy or with a model or something like that. And I've always found that so difficult, even though I've done those for years. I actually teach on them now, especially if they want me to do a demo in front of people. That anxiety then makes that even worse, and it's like my brain just goes stiff. And so the fear and the frustration is that it makes me look less able. Which isn't true.
No, absolutely. You only need to be talking to you for moments to realize that absolutely isn't true. I think Nana's attic is abundantly full. That's pretty obvious.
Full of like the lion costume that she made when she was about 17.
My mum did make my kids and their cousins lots of animal costumes that are in the attic. So there you go. That's not such a silly example.
Yeah. I remember my grandma and grandpa used in their attic the most terrifying horse costume I have ever seen in my life. We were scared of that attic.
Was it like the one in, you're younger than me, there was a horse in, do you remember the programme Rent a Ghost? Or are you too young for that one? Oh, shame.
Sorry.
Some people listening, lots of people listening are as old as me. They'll remember the horse from Rent a Ghost, who was terrifying.
Absolutely terrifying.
So how does that work? I've spoken to quite a few physiotherapists with various neurodiverse diagnoses and presentations and traits, and quite a common comment is that physiotherapy actually is the ideal profession, and sometimes on the back of that they say because it requires you to hyperfocus. Actually, that's the point of the job. What's your take on that?
I think it depends on your specialty. I think in any job there's peaks and troughs, and in every area that I've worked in, be that NHS or private clinics or sport, as I predominantly am. There's things that do lend themselves to neurodivergent people. And I can see how in an outpatient department or like a private clinic, it would be sort of quite regimented, and you've got this focus on this is the rehab plan, and it's quite controlled. The difference in the sort of the area of sport, when I say sport, I mean I work with teams pitch side, traveling to camps and competitions, managing them remotely, all of that kind of thing. I know that sport obviously encompasses a broad range of people, so like your weekend warriors and coming into clinics and things. So sports physios are still in clinics. So to an extent, when you're working with teams at camps and comps, there's obviously a schedule that everyone sticks to and we follow. So that really helps. And you know exactly when you're eating, you know when you've got time to go to the gym, you know what time you've got to do meetings and be ready for this. But there's also a huge amount of last minute changes. There's a huge amount of energy requirement, both in terms of physically, like you're carrying kit around, you're running on and off the pitch, you're taking the sort of physical load in a lot of areas so that the athletes or the players don't have to. But also the social and emotional energy transfer, in terms of we have to give our energy to the athletes. We are very social. How we behave and how we act will influence how they are able to perform and feel within that environment. And so all of that is very, very controlled. And for a neurodivergent person, that can be quite a drain. Not that I don't absolutely love my job, I really do, but it does mean that I have to be quite conscious of what I do around that in order to keep myself in the best place. And so in terms of employers and sports and national governing bodies, I think we're still relatively in our infancy in how we support a broad range of staff. But, just for the purpose of this neurodivergent staff, we are only really starting to discuss and make accommodations for neurodivergent athletes. And the sort of running joke of, I can't remember who I was talking to the other day. He was a former athlete, and now they're in the staff group. And I'm like, well, no one cares about your well-being now. Come on, like everything's on the athlete. That's
You're
not
down
true,
the pecking
but
order.
yeah, you've dropped down the line now. Come on, we've got to just dig in and get stuff done. So yeah, I think there's a way to go in a lot of sports. I can't speak for every sport, but I think there's a lot of progress yet to be made.
And then I know from when we spoke before, you said there have been incidences where really there has been a lack of accommodation that has caused you some quite serious difficulties. You talked about the time where you was it that you couldn't get your medication while you were away?
Yes. So as a neurodivergent person who lives on their own, I don't sort of have someone to conversationally drop in, or why don't you split your meds between like your hand luggage and your whole bag, etc. Like in 25 years of air travel, I have only lost a bag once, and it was back with me that evening. And sod's law, because of the country that we were going to, I was a bit concerned about medications, and I'd never been there. I was concerned about the medications getting taken off me at the airport if they were in my hand luggage. And so my head was focused on like, right, I need to get them there. I need to make sure that they are there because I know that I need to take these to keep me in a good place.
Yeah.
Or at least for the withdrawal from some of the meds that I take is not helpful. And sod's law, the bag went missing for 5 days.
Gosh.
So that sucked. But I mean, the sort of, I know I sort of joked about the no one cares about your well-being, etc. But actually one of the real positives of sport is that in the majority of environments, the people that you work with are very team focused. Like it's pull together and look after our own kind of thing. And I was super grateful and super lucky to have some really good staff and athletes when that happened. So, things go wrong, and we just make the best of it. We get stuff done. I think previously, so the medications are actually quite a recent addition in terms of being able to help my neurodivergence and kind of secondary mental health things from that, because I wasn't diagnosed until I was 30 for autism and 33 for ADHD. So the majority of issues I've had in work have been around a lack of accommodation because they didn't know and I didn't know either.
Yeah. Okay.
So I mean, my view is that the world in general and work world in particular should flex and support getting the best from an individual, regardless of whether they've got a specific diagnosis or not. As you get to know them, you speak to them, you know what they need, and you work accordingly. But that isn't how it works in reality. And so I didn't have a diagnosis. I had various people over the years suggest that I get assessed. And so, yeah, there was a number of difficulties from, school, work, etc., that then impacted mental health and impacted working capabilities and things. So, but yeah, it was difficult, but peaks and troughs.
Well, it's good to hear you say that team atmosphere helped, but I do know that a lot of the medications are quite short acting, so the effects of not having them with you can be apparent pretty quickly, can't it?
Yeah.
And there's some thing you just touched on then, really, which I take as how aware are we as a society of what behaviours may or may not be what they seem. And I shared with you, I've got some experience in my family of a child with an ADHD diagnosis, and I'm aware of I think the two labels that spring to mind, and please feel free to add more, are being lazy and being difficult. So this person is lazy, this person is difficult or awkward. You're nodding your head with those.
Yes.
How do we, so I mean, those are such common labels, aren't they? You hear kids at school being described as lazy. There's always that difficult person in your yoga class, or that awkward somebody or other in some other walk of life. And sometimes that is true, isn't it? There are lazy people and there are people who are just more difficult. But it's I think now we're all looking back and going, okay, how many times have I used that label when actually there's a lot more behind that?
Yeah, and I think it is difficult because we are brought up in the way that we are to label people quite quickly. And I think particularly in women and girls who are neurodivergent, we are more easily missed in diagnosis. We are more commonly late diagnosed. And it's also known that as a result of that, there are increased, so misdiagnosed or not diagnosed at all. So people get diagnosed with bipolar disorder, or they have eating disorders secondary to the way that they feel a result of masking, in terms of trying to force that societal way that they have been told they are supposed to be. And the negative impacts of that can be massive. I've experienced that for a number of years. I remember specifically being at school and just saying, just don't be yourself, like they don't like it. And I would repeat that to myself and try and modify myself to be that way. But as my social acceptability went up, my mental health started to decline. And so that was quite difficult. But as you say, it is hard to filter out those who just function differently in a society that isn't designed for them, versus people who, through whatever reason, might just be more difficult or, invert commas, lazy, etc. So the laziness is quite often with neurodivergent people is actually struggling with executive function, and being able to initiate and action things. Being difficult is having a need for detail in order to make those next steps. It's having a really strong moral compass, and a real physical discomfort from injustice and lack of fairness, and things like that. And so unless you do get to know that individual and can understand the rationale behind it, it can be very easy to label people that way. And I've been labeled a problem. I've been told like that I'm not allowed to have the detail, that I need to do what I perceive as the best job that I'm able to do. And it is difficult. And I think, having the diagnosis, I know that I'm actually very fortunate. I'm very privileged to have been able to afford to go privately to get those diagnoses, because the NHS route was either, 6, 7, 8 years plus, or the route was not suitable for a female identifying individual to be assessed via, because of the lack of understanding of masking and things socially. There's loads of labels. You need to understand. I've always said that you need to get to know me to understand there is always a reason for everything that I do. And it is never, ever with any malice or desire to be a problem.
Yeah.
And I think that's a really common thing for neurodivergent people.
Yes, and say with my brief experience of that, I'm nodding away, because my level of understanding went up because I had someone I care about deeply struggling with exactly the things you talked about, and had to understand it. But unless you are that close to someone and really that emotionally invested in their well-being, do you take the time? Do I take enough time with other people who are less close to me in these situations? But I think what you just said is really worth highlighting, those very specific distinctions, that laziness is often an executive function. The person wants desperately to start their homework, finish their PhD, go and have a shower, but it doesn't mean that the right triggers or the right things are going on to make that activity become initiated. And then you put it beautifully, if we reframed awkwardness as someone who needs detail, desperately wants to understand, and has such a acute radar for injustice that they cannot tolerate what they see, and also cannot keep quiet about it. If we reframe it that way, I think that's helpful. And I don't know what you think about, I saw a meme recently, and it said, the next time you label a child as attention seeking, just try putting the word connection instead of attention. And
behavior is communication.
Yeah.
Absolutely. Behavior is communication. Why are they behaving that way?
Yeah.
It doesn't just come, from nothing. A child isn't born wishing to be difficult.
No.
We're all born with an inherent want to be liked. That's whether it's an ego thing or not, but human beings want connection and love and to be liked. And so it's not a natural thing to want to go against that. What have they experienced, outside of the environment that you're seeing them in? What's gone on for them previously? I think I had a conversation recently around some extra equity, diversity and belonging stuff around an experience I had. And it was just abundantly clear that this individual hadn't considered that what you may think is a correct response and a normal flat response to how you treat anyone doesn't take into account that actually you're dealing with someone who is neurodivergent, who would get a lot of rejection sensitivity feelings, who is also from an LGBTQ plus background, and predominantly that marginalized group in terms of experiences when you're younger, and what people would deem as trauma now, and the way that group is treated in terms of their experiences of society, and how that action impacted that person. While it might be proportionate, that's the word I was looking for, proportionate for someone from one background, you've not considered it in this way, or the impact that has had. And I think that's there's a depth that current EDI tick box style training does not achieve in terms of lived experience and anything beyond, okay, so this person is diagnosed autistic, but were they diagnosed as a child? Have they had support throughout? Have they had modifications and so know what they need to ask for? Have they been diagnosed as an adult? Therefore, have they got things in place, and actually switching to these things which we think might be supportive is a change in itself, and that's quite overwhelming. As a result of them not being diagnosed when they were younger, do they have experiences negatively with social groups, with presenting publicly, with social elements of networking when we thrust them into a conference style situation and tell them to make connections with people? And it's the context, again, that I think a lot of that is missing, and that single plane view of a marginalized group, let alone intersectional individuals. It's just a bit shallow for me at the moment. And I know it's so difficult to get a decent understanding of every different marginalized group's experiences and every individual's intersectional experiences as each of the groups that they occupy. But there's got to be a way that we can be better at this.
And what's going through my mind, and I hope it isn't an insultingly reductionist way of thinking about it, but I'm just thinking, so if I come at a conversation with the assumption that this person is coming from a good place, because as you say, not just children, most people are coming from a good place, because why would they not be? If I just take that as read, what else could be playing into this behavior that why am I seeing this picture? What else? What is my imagination capable of in terms of what could be creating this that I'm witnessing at the moment? Yeah. If I just take it as not in question that their motives are good.
Ask questions.
Yeah.
Ask before you act is listen to understand rather than listen to respond. If you're listening to respond, you aren't absorbing anything, and so you won't understand and potentially change your view. So I worked for a private company just in clinics a couple of years after I graduated, and got on really well with the staff that I interacted with, and was generally thought of quite positively, I think. And then there were I think it was two complaints made, and I think it was generally to do with communication, in terms of I had said something which I felt was what I was told to say. And rather than actually say, oh, this doesn't seem like Charlie, they immediately just put me through a disciplinary process. And so even to this day, the thought of going back into a clinic environment makes me feel physically unwell. And I will never do it. So I think that's the thing, is ask questions, think about the person that you know, or always try and come at it from a giving benefit of the doubt, not in a dismissive way, but in a, I'm going to assume that most people are not horrible.
Yeah.
Ask the questions rather than just jump in.
Yeah. So, gosh, I didn't know that, Charlie, so what you just said, that circumstance has literally killed the opportunity of working in a clinic in that environment for you ever again.
Yes, I think so. Obviously, especially with my foot injury, working as a pitch side physio is probably not something I'm going to be doing into my 60s. And so sort of contingency planning and everything else, like a lot of people will go into private practice and, want to set up their own practice. And people sort of will quite often say that to me. And I'm just like, nope, absolutely not. That is not something that interests me in the slightest. So yeah, that's tainted that. And I think there's a number of experiences that, looking back, could have been handled differently with a different lens, or if I had had my formal diagnosis, would I have been treated differently in a number of ways.
Yeah.
But I think also it's shaped who I am. Not that I think there's the tendency of some people to say, oh yes, difficulties will make you, stronger and everything today. I'm like, no, you didn't have to deal with that. Someone didn't deserve to deal with that. And being made stronger is not a justifiable thing to say to someone who has experienced that. Yeah, I
that doesn't
think,
sound a terribly
yeah,
helpful reflection, particularly
no,
on behalf of someone who hasn't
but it
had that
certainly taught
experience.
me what I don't want to be
Yeah.
in terms of an environment. If I was, in a position where I was creating an environment or supporting others or a leader in a particular role, I know how I wouldn't want the culture and environment to be. And I've seen enough environments to sort of, cherry pick what I think was positive, what I think might not have worked, and things like that. I think it's a complete false economy in the we've got to push people to, you must operate in this environment and you must be in so many days a week and you must do this way. I'm very much more a lead with the carrot, not the stick,
Mm.
kind of person. I think if people are happy, supported, have a good work-life balance, I think actually you'll get so much more out of them, because generally the people that, certainly in physio, they want to help. We're the
Yeah.
helping professions. We want
Yes.
to do our jobs and we want to do it well. Um, I know that if people have made me feel undervalued, then it mentally, and it's being shown about Gen Z, um, about that sort of emotional and mental, not conscious, checking out of work if they are unhappy, undervalued,
Yeah.
and things like that. So I think it's just smart business, if nothing else. But
Yeah.
I just don't see why I would want anyone that I was working with in a culture to feel like they weren't valued, regardless of whether they're, a week out the door of university or they've been working for 30 years. Everyone's got a different experience to add, and we should just look at it positively and not like everyone's needs to be helicopter managed.
Yeah. It's so true what you just said, actually. I hadn't registered the Gen Z. Well, no, actually, I did. It was an article I just read at the weekend about. It didn't use I don't think it used Gen Z, but it was talking about people in their 30s, many of whom had really high-powered jobs. The article was something. It was something like going into a soft way of living, which perhaps wasn't the most helpful description, but it was
No,
talking about people who'd done brilliantly at school, brilliantly at university, brilliantly in their first job, and then completely checked out. And there was a girl they were featuring who now lives with her parents, and she sells ceramics, which she makes in the parents' garden. And it was a strange article because it was sort of the positives of that lifestyle were being sold, but it didn't address the toxicity of the
why does she need to do that?
yeah. Yeah,
Yeah, I
why
mean, it's
does
great, fantastic. Do what makes you happy. Go Queen. Like, I'm here for it. But yeah, it's how can we, and I can only speak from my own experience. I know that, and part of it is the neurodivergent element, but if I'm passionate about something, I'll do it for hours and hours and hours. Um, and I'll never get bored, and I'll go above and beyond, and you'll be paying, from a purely financial perspective, you'll be paying pennies for actually what you'll get.
Mm.
But if I am bored or understimulated or feeling like I'm not valued, my voice isn't heard, I cannot help but effectively be trudging through treacle.
Yeah.
And it takes more energy to do that. And so I have to stop sooner. And it just, yeah. And I
Mm.
think that really it happens for everyone. It's not just neurodivergent people. I was chatting to a friend who works in a special needs school ages ago now, and what she was listing off as things that are in place at this fantastic school for kids with extra support needs. I was like, well, that just sounds like good things to do for people. And she was like, yeah,
Mm.
there it is.
Mm.
But we just do this because these kids have extra support needs. We don't get to
Yes.
do it for everyone else, when actually we could just roll things out a little bit more. Everyone chill out a little bit. Like I just yeah. And I think we'd actually have a much more productive, happy workforce. Less money spent on yoga classes and pizza parties and things, and actually
Yeah.
look at what impacts people's mental health, what impacts people who take time off work through, either injuries from being at desks or mental health problems or stress. Let's build up, not, keep it so tight that there is no room for growth.
No, and you almost, when you were talking just now, created what would be such a perfect, I don't know, first day question. Again, you know, starting from a good assumption. So say the question was, so I'm assuming you are going to want to do the best possible, let's say for your patient, if it's a physio job, what do you need so that, or are there any barriers to you delivering the best possible care that you can for your patients? And as you say, not for just neurodivergent people. If you said to everybody, I'm assuming you're going to want to do the best possible job you can, who's going to go, no, actually, no, I don't really.
Yeah, I don't really care. I'm just here to take your probably quite rubbish paycheck and leave.
Yeah, particularly if you're talking about healthcare.
Well, exactly. I'm like, if you're in healthcare, you ain't in it for the dollar bills, are you? No. Unless you're working possibly in some very lucrative football jobs, but not many of those.
No, I haven't come across those yet.
Mm-mm.
So, Charli, humour me. A lot of the stuff we talked about a few weeks ago is coming back to me, and you threw me a few labels that you hate. And I can remember you saying, I hate the word sexuality. Oh, and also patriarchy, feminism.
Feminism, yeah.
And I really hate when people say everyone's a bit on the spectrum.
Yes, I do.
So I want to talk about all of those, but which one do you want to start with?
Let's go through the list. Why do I hate the word patriarchy? I think, so my view on language and words is, so some people get really het up on individual words in physio specifically. They're like, oh, you can't use the word release. Well, I'm like, yeah, but you know what I mean. You know what I mean when I say that. Yes, it might not be correct or exactly what we're actually doing, blah, 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 whatever. That's probably a terrible example. But we know that each word has an association with it in terms of what it means, inverted commas. Patriarchy, I think, is something that people don't understand. And when you say patriarchy, because we've got things like paternity leave, it is inherently linked to men, but it is incorrectly perceived as a hatred of individual men in current society. Patriarchy is a long-standing, societally built situation that does impact negatively all genders. And that includes men feeling that they are unable to visibly show emotion in the same way as women or, you know, gender fluid, non-binary people may feel able to. That toxic masculinity element, as much as it negatively impacts women, for the sake of using binary there. And so I don't like using the word patriarchy because it automatically gets people's backs up and it's almost a blocker to conversation and improving understanding.
Yeah.
When actually that negatively impacts everyone, and actually we could be a lot better.
Yeah.
So I try to avoid using it in conversation.
Yeah. So it's that, as you say, because patriarchy is associated with the male, and
Yes.
that sort of assumption that it's male against female, dominant against weak, and that it's all gender based.
Isn't it's the way that it has developed. Like, and you have to look back historically at a number of things. I've recently started reading around more sort of pre-colonial history around LGBTQ plus experiences. And things have developed over time the way they have for a reason. But does that necessarily suit us now? I don't think it does. And I mean that for everyone. It's not like it, especially as a gay woman, people can very easily jump to being like, oh, you just hate men. I'm like, no, that's not what it is. But yeah, and I think that's similar to the feminism side. Everyone thinks it's bra burning and we hate men and blah, 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 and that's absolutely not what it is. Feminism is not that women should be in charge of everything and men should be the subordinates. It's, I think someone said the phrase, everyone is a feminist until they are developed to be a misogynist. Like, no baby or child is born believing that anyone should have any less rights than anyone else. And that is feminism, is that there's an equity in rights. And I think in terms of understanding the difference between equity and equality and the importance of that, is that equity is the support and equality is the outcome. So your equity is someone who is neurodivergent might require a specific adjustment in order to put them on the start line next to somebody who is neurotypical. And that's that. So that's equity. So someone who's neurotypical might be like, oh, I don't have this extra support or this adjustment. But no, because just to be level on the start line, equal in terms of opportunity and outcome and access, you have to have an equitable input. And so feminism is truly more about, it's about equitable and equal existence of all genders and minorities.
And equality, you say, is the positive outcome of equity.
Yeah, so equity is what you put in place. So I think either the three kids looking over the fence at a football match, one's really tall, one's medium-sized, and one's too small. The tall one can already see over the fence, the medium-sized one can't see over the fence, and the short one can't see over the fence either. If you put them all on, give them all equal input, you put them all on one box, the medium-sized one can now see over the fence, the tall one can still see over the fence, the short one still can't see over the fence. Take the box off the tall one, who can still see over the fence, give that box an extra box to the short person, and everyone can see over the fence. I don't know if that's very clear.
No, it is.
And that's equitable. They have more support for the shorter person because they need it in order to be able to see just like everyone else can.
Yeah, bringing everyone up to a level.
Absolutely, it's putting everyone on the start line together.
Yeah, and actually that's what I like about that is you're not then presupposing an outcome. So say to take your analogy further, so those three kids can look over the fence to see the football team, that one or all three of them may want to join, and one or all three of them may do very well in. So you're not then getting involved in that, but you are creating the same opportunity.
That is exactly it. And I think people will mistake extra support for being given a pushed advantage.
Yeah. Positive discrimination or.
Absolutely. Yeah. I was discussing this with someone the other day, actually. I talk about this kind of stuff all the time. It's really sad. But yeah, like two of those three people might have absolutely no desire to be involved in the football team. It might actually only be the tall one who wants to be involved in the football team, who had the access to start with. But the other two might not have known anything about it because they couldn't see it. But they've had that access and they've had that opportunity because of the equitable support for them.
And then you've got to guard against the judgment around the smaller kid rejecting, oh, we gave you that big box and you still didn't.
Absolutely. Oh, how ungrateful. You have to do this. Blah, 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 blah. No, just give people opportunity. It doesn't mean they have to take it. Yeah. We might still end up with different, gender balances within specifically traditionally gendered roles. But as long as we know that access is equitable and the view of that is equal. So it's not that we have less male midwives because it's perceived as beneath them and the caring duties are not good enough for men. There's some fantastic male midwives and nurses, and equally women getting into engineering and everything like that. It's that power balance and that perception is massive. And I think there's a lot of misconception around this whole topic based on perception and preconceived things that is actually really damaging from everyone just being a bit happier.
Yes. And with you educating me further on those two words, something occurs to me that we talk a lot about health inequality, but we don't talk about health equity.
Yes, correct. I think even the words, and they are changing. So EDI used to be equality, diversity, and inclusion. Yes. Whereas actually, so I'm on CSP committee for equity, diversity, and belonging, which I think is much better wording, but various organisations still use it in different ways. Equity in terms of the action that we're trying to create is equitable support. Overall, the equality side of it should kind of take care of itself if we're giving equitable support. And the belonging is, I don't just want to be included as someone from a marginalised group. I want to feel like I belong. It's like fitting in versus belonging. letting
exactly.
somebody show up versus them being truly comfortable and belonging there.
Yeah.
And so
Really
language is
welcome as
really
opposed to
important.
tolerated.
Completely.
Yeah. So let's keep going through the list. Sexuality.
Sexuality. I hate the word sexuality because it immediately turns everyone's minds to sex and physical interactions of different sexualities and orientations. I think so many, and they are microaggressions, things like, oh, how do you know you don't want to be with a guy if you've never tried it? And I'm like, God, how did you know that you were straight? Like, at what point did you have to come out as straight to your family? All of this kind of stuff. I would hope that, you know, people with partners in heterosexual relationships are with their partners for something other than physical relations. You know, there's love, there's things in common, and it's exactly the same for me. So please do not immediately start thinking of physical aspects of a relationship, a romantic relationship, because of the word sexuality, and it bothers me a lot. And there's all sorts of preconceptions that we could go into about what gay men do or don't do, and what gay women do, or various different forms of relationship, like aromantic, asexual, like gender fluidity and pansexuality, and various bits and pieces that are all very intertwined. But yeah, I think the word sexuality, the first three letters immediately put someone onto sex, and it makes me uncomfortable, because I'm like, why are you thinking about what I do with my partner?
Yeah, you see it on TV, don't you? There's so many representations of heterosexual couples. There's a story, and there may or may not be a sex scene in that story. But you know, I'm sure some will point out where I'm wrong on this, but I can't think of a representation of a gay relationship where there isn't some sex scene that is really explicit. This is a gay relationship because they're having sex together.
It becomes really aggressive. Yeah. It's so
We're not going to avoid it, we're going to show it.
Yes, we must. We're okay with it. Everything's fine. So we're going to show it really, really aggressively.
A lot.
Yes. It's like you either get the slightly sort of, and it's changing, it is a lot better. But the only sort of gay visibility that was, well, to be fair, there wasn't any when I was growing up because of Section 28. In schools and everything, it was all illegal. But yeah, it was kind of either the sort of real dark street corners, smutty stuff, versus what was just completely normal. And then you hear people saying, we can't teach, you know, homosexual or LGBT sex ed in schools because it's going to, okay, it's not a kink. It's not like, and we're not teaching BDSM to 4-year-olds. Like it's about families and relationships and different families and consent and trust and all of that. And it's just absolutely mind-blowing. And the fact that people think that knowing that LGBT relationships exist in school, and they think that their kids knowing they exist is going to make them gay. Believe me, I was exposed to a huge amount of heterosexual content throughout my formative years, and I am still here, still queer, no matter how much my dad didn't want it to happen, and how much society didn't want it to happen. I still found a way, so I don't think that's going to happen.
Great point.
You just end up with those people who have gone with the societal norm and ended up with a relationship with someone of the opposite sex and actually realise that they're gay later on, when actually could they have been so much more comfortable in themselves and you know, discovered who they truly are much sooner. And I just think I just want everyone to be happy.
Actually, one series that I have come across that seemed to me to be taking a slightly different stance. Tell me if you've seen it or not. It's Heartstopper.
Haven't watched it yet. I've had a lot of good reviews about it, and yes, I think that probably is one, but I've not seen it. I think there's a lot more educational stuff, like It's a Sin. Did you see that on Channel 4? Very useful educational wise. Gentleman Jack, all of that kind of stuff. Just gives, I think it's just a lot of context and history and reality and normalizing something which actually is very normal and has been around and documented since, you know, in Greek mythology and Roman times and everything else. So
yeah, Yeah. So I don't think there are any other single words on the list, but I do remember you saying I really have a problem with and I have used this phrase, so I'm going to sit here and be educated by you again. Everyone's a bit on the spectrum.
Yeah, to an extent, they're right, and it depends on the context to which it is used. So everyone's a bit on the spectrum in the sense that there are certain neurodivergent behaviors that a lot of people will display. So they might have one or two, but it doesn't impact their day-to-day life. And there is a threshold for diagnosis, though. So there is a point where you are autistic, for example, or not. You might have, and this is part of why it's better to just treat individuals as individuals in the workplace, and why it's important to understand what every individual needs. I sought diagnosis because when I got my diagnosis, it was incredibly validating that things I had found incredibly difficult for my entire life, it was from a real thing and not just because I was shit, which is what I had grown to believe. And the autism spectrum actually more appropriately applies to those who pass over that threshold. And there are people, especially because of the failings of the diagnostic system for neurodivergent people. So there will be people who self-diagnose, and I think that, gives people a lot of grey area who think, oh, we didn't have this before and things like that. But actually it's a spectrum condition within the autistic group itself. And so you'll have someone who might be nonverbal. You might have someone who is particularly difficult with quite aggressive stims, or someone who is incredibly functional, but actually struggles a lot out of public eye. There's that spectrum of who has what need within that diagnostic group. And when people say that, I think, certainly in my experience, a lot of it has been to almost be supportive, like, oh no, there's nothing wrong with you. I know there's nothing wrong with me. One of the reasons I didn't get my diagnosis on the NHS was when I was assessed, it also had a report from my mum, who was like, there's nothing wrong with you. It's like, no, there's nothing wrong with me. But this will make a big difference, and it will be very validating. And I do have struggles that would be helped by having that formal piece of paper that means that I can access certain things. So when people say everyone's on the spectrum, I know that a lot of the time it is to be like, oh, there's nothing wrong with you. Everyone's got different struggles, and I appreciate that. But the way it feels is that actually you're just kind of looking for attention. Actually, there's nothing really wrong with you. And it's very much
that you're not handling it as well.
Yeah, exactly. And it's difficult. And I think it's not something to say flippantly unless you really know that person. And there's friends that I've got who know me really well who will drop that in at various points. And it's because they're completely unaware. I would never purport to be able to understand the experience of a Black person or someone from another race. Like, I can't do that because I cannot see it, because it is completely out of my experience. And so it is just being conscious of how you speak to people and how you make passing comments. But we are and we aren't all on the spectrum. I'm not sure if that's given anyone any clarity, but yeah, I've pondered it.
Yeah, well, we've made moves with OCD, haven't we? I mean, how many times do we always say I'm a bit OCD? Thankfully you don't hear that so much anymore.
Yes,
I'm just thinking about diabetes. You don't say I'm a bit diabetic. You might say I'm quite sensitive to sugar, but I don't cross that threshold of a diagnosis of type 1 diabetes.
Exactly. Yeah. It's you wouldn't say that about someone with a broken leg. That's a terrible example, but you know what I mean? Like, we've all got a little bit of a broken leg.
Yeah.
No, we don't. There's bone turnover, but it's not broken.
Yeah, there is a threshold. So I feel like, rightly or wrongly, we've focused heavily on the neurodivergent and the LGBTQ side of your ands.
Yes.
Is there anything you wanted to cover today, either in that or the other ands that I haven't asked you about?
I don't know, really. I mean, I suppose the sort of invisible, I think it kind of ties everything together. So I've got my foot injury, which I have a blue badge for now, which is quite exciting.
Yeah, okay.
And but to most people with, you know, be it my neurodivergence or that physical disability or my Ehlers-Danlos hypermobility stuff, to most people on the outside, they'd look at me and be like, nothing wrong with her. Absolutely fine. I work in high level sport. You know, people would look at my CV and be reasonably impressed. But it's what I have to do in order to present that is quite a lot. And this isn't just for me, it's sort of just maintaining an awareness for people of actually someone might have a blue badge who you think doesn't need a blue badge because you see them as completely normal. And actually my blue badge, especially when I'm at work, if I can park somewhere close by and I have to carry something heavy rather than having to carry, you know, a treatment couch and everything else 100, 200 meters, however far to get to a venue or anything like that, actually that cumulatively means that my foot isn't going into spasm quite so much. We had a travel day when I went away with a sport to Spain last week, and I couldn't put a slider on my foot when we got there because as soon as I did anything with my foot, it went into spasm. And it was so painful. And a lot of people don't see that. So I suppose, yeah, if someone's got something like that, is just accept that, yes, they might have chronic pain or things going on. I remember someone saying to me, oh, you don't look like you're in pain. And I just thought to myself, well, no one wants to hang out with you if you cry all the time. Like, what do you want me to do? Just not get on with my life and try and be as joyous and enjoying as possible. And I think it's something that, again, it's a flippant comment to someone who has clearly got something in place for a reason.
Yes.
And you being dismissive of that or making them feel like a bit of a fraud when they probably question themselves on a regular basis anyway, because they've got all these things in place so that they can function as normally as possible, is just to be considerate of that.
I was really, when I was talking to Charli Gibson about this, she talked in great detail about the number of strategies that she employs on a daily, weekly, moment by moment basis to, I suppose I took it as to not inconvenience anybody else. And, you know, I'm just thinking maybe flippantly, when you receive that comment, oh, you don't look like you're in pain, you can almost respond, well, that shows how well my strategies are working.
Yeah, this is going brilliantly then, isn't it?
Yeah, I passed with an A+ on me not inconveniencing you.
Yeah, I think that's, I think I might have said this last time, the inconvenience thing and the superficial nature of that EDI training is we will adapt and adjust for you until it becomes an inconvenience for us. It's fine as long as you are societally palatable. I've only knowingly had there's been twice, once where I have had a very significant internal meltdown at work and managed to get myself away, and once when I had a full meltdown and couldn't speak, hyperventilating, etc., like beyond what most people would deem as reasonable. And thankfully there was a snapshot, and I was working with a coach who has a daughter who is also autistic, and so she really understood it. But I was hyperventilating in my room and crying for hours, like hours. Even I was there like, why can't I stop this? And it's that people need to remember that actually does happen.
Yeah.
Whether you see it or whether you don't, these people from various marginalized groups will have their own experiences and difficulties that you won't see because they are working so hard to put on the front that a neurotypical, whatever typical else society expects of them. And in my job in sport, it's pretty high priority. So meds or not, you put on, it's showtime. And you deal with that away from anyone seeing it. But I think just a bit of kindness, that some people might actually go through that kind of stuff away from public eye. It does not mean that they are not able to do their job absolutely fantastically, but it just takes a bit of kindness. And sometimes that might inconvenience you a little bit.
I have a friend, a very kind friend. Just as an example, she's currently teaching a Syrian refugee lady to drive, because the lady doesn't even speak good English, and my friend is not a driving instructor, but she just does that kind of thing. And my friend's phrase is, true kindness is always inconvenient. It's easy to do the convenient kindness, isn't it? The things that don't cost us anything, but true kindness usually is pretty inconvenient to administer.
Yeah.
You also reminded me of something Martin Christiansen said in a much earlier episode of You Matter. He's a Norwegian physiotherapist, and he came on to talk about his depression, intermittent depression over the years. And you just reminded me of something you said there. He was talking about, on the days where I seem a bit off to you, I seem a bit low, that's still one of my better days, because I'm not going to let you see the others.
No, absolutely. I would never, ever. I think there's one person in my anywhere that's ever seen like full, I do not know what to do with myself. Yeah, and that's because I make it that way.
Yeah.
And it's hard. Like this isn't me saying, oh, woe is me. Far from it. I love what I do. I like, performing at the level that I do. I hate sloppiness. Like I have really high standards. And that's one of the reasons that I do the job that I do. Like that performance level of stuff is something I'm really passionate about. But yeah, people with different needs. And I think it probably, if everyone was a bit more open, you'd know that everyone had different needs and everyone has struggles that they go showtime for and things. Exactly. But it's hard. And yeah, exactly what Martin said. No one has ever seen, apart from maybe one person, the really difficult days.
Thank you for talking about that so honestly. Well, all of this. There are two questions I do want to ask you.
Yes.
First one, I didn't ask you what your PhD question is.
So I am looking at the influence of different pitch surfaces on injuries in professional men's rugby union.
Different pitch surfaces?
Yeah, so artificial rubber crumb, hybrid or natural grass, and influences of those on injury rates, severity, burden, etc.
So is your house full of funny bits of rubber and different
substances? Do you know, not, but it is full of lots of like post-it notes of don't forget this, or this is the this is the schedule for the season, this is the fixture list, this is the kind of surface that they have here, and this is when they change surface, and it's all very, very geeky here.
You must have some fantastic spreadsheets.
Oh, I do. Very large, unwieldy spreadsheets. And when people ask me, usually I'm just like, I spend a lot of time thinking about flooring, and it's really sad. But here we are, plodding along.
And my other question, red and white wine recommendation for this weekend?
It depends, as in the answer to all questions. Budget, well, so my easiest is whenever I look at a wine list for white wine, which is probably the wine that I would drink if I wasn't just having it with a meal, is a Marlborough Sauvignon. So New Zealand, cool temperature, cool climate Sauvignon Blanc, very, very drinkable. And if I see a wine list, especially in sort of more commercial bars, which doesn't have one on, I just think you are mental, because they are so drinkable, so popular, so well priced. So white wine, Marlborough Sauvignon, very easily drinkable. Red wine,
I mean, let me put a very specific request in. if one happened to be perimenopausal, completely unable to drink white wine without getting a banging headache, and also not able to tolerate more than one glass of red wine, what might you suggest for that person?
Outstanding. I would recommend, I think, and this could be complete rubbish, I think it is sulfites
Yes.
in wine that causes the problem. There are wines without sulfites in, or much lower levels of sulfites. My friend's dad has to have these. I can't remember it off the top of my head. It's like a specific brand as well as a specific type. I'll look it up and I'll message you about it. But
Please
sorry,
do,
listeners.
with the public service and knowledge that a large proportion of my audience would fit
Absolutely.
that category.
Yes, if you like a lighter red wine, your Pinot Noirs. If you're feeling a bit more fancy, you get your Beaujolais. They're quite nice, a little bit of red fruit, strawberry kind of stuff. Your heavier, meatier ones, your standards, your Malbecs and things like that. Your Cab Sauves, your aggressive wines. But yeah, it very much depends on what you're looking for.
Yeah. All
God,
good,
that
right.
sounded awful. I'm not even a wine wanker. I think what good wine is wine that you like is my favourite phrase. It
No,
doesn't
you
matter.
don't need to qualify. You don't need to qualify. It's fine.
I'm neither a piss artist nor am I a wine wanker or a wine snob. I just know things.
Yeah, and if you like it and it's nice, drink it. Yes.
Exactly.
It
doesn't matter
make
what
you
it
feel too terrible.
costs. Do you. Just drink what you like.
Well, I think that ties in with the theme of most of what we've been talking about today. So maybe that's a good place to end.
Absolutely.
Charli, thank you so much for agreeing to come on, and thank you for talking around all those topics. It's been a brilliant conversation. I really appreciate it.
It's been great. Thanks, Jo.
Pleasure. Take care, Charli. So thank you for listening to the episode. I knew Charli would be a great guest. I had a little pre-episode conversation with Charli a few weeks ago, and I just knew that was going to be a really great conversation, and it didn't disappoint. Just after we stopped recording, Charli and I had an extra little discussion around this idea of assuming the best when you're with somebody, when you've got people perhaps working for you and with you, when you're interacting with people in general, this idea of trying to understand what the behavior is, what's behind the behavior, what's going on for anybody really in the whole round context of their life. And what we were just talking about was the ability to do that depends so much on your own internal state, your own regulation. Maybe that's not such a sort of rocket science observation, but I think it is worth mentioning that when you're not tired, when you're not hungry, when you're not thinking about a million other things, you will have so much more ability to take a moment and to give someone the benefit of the doubt and to consider all the other things that might be going on for them and to ask that extra question. So we talk a lot on this podcast about how difficult clinicians find it to take time for themselves and to take care of themselves. And this concept of self-indulgence is always lurking somewhere in the background. So if it helps at all, if you've got any of that stuff going on, apart from anything, it just looking after yourself gives you a much greater chance of being the better version of yourself for the people you work with and alongside, and also for the people you serve, your patients and your clients. So I would love to know if you identified with things on that episode. I would love you to know if it has made you think about other conversations you'd like me to have. And also, I forget to say this all the time, but if you're enjoying the podcast, then please do give us feedback, give us ratings. It helps to push things up the podcast charts. And at episode 38, You Matter is only 3 years old now and going strong. And I'm still loving doing this podcast. So anything you can do to help spread the word and make sure that as many people as possible are benefiting from these conversations, I would really, really appreciate that. So, I can't think of the preamble to my final sentence today. What can it be? So if you are someone working with other people who might need you to be at your best so that they can be at their best, then do not forget that that requires you to take time for yourself, to understand and address your own needs, to set boundaries, to really do the things that you need to do to be in your best state. If you need to do all of that, then remember that you matter.